Hi, my name is Linh Vo, and I am an Associate Marriage and Family Therapist, and I am the CT Stream Intake Coordinator. Why is therapy beneficial? Therapy is beneficial in a lot of ways because it can treat mental health struggles that someone is going through in the moment. So whether that means that someone is struggling with, stress in their career, or they're struggling with depression that they've had for a long time, or they're discovering that they have symptoms of a psychotic disorder, or they have symptoms of ADHD, anything related to your mental health that is impacting your daily functioning, that is something that can be treated in therapy. What is therapy? I like to think of therapy as a collaborative space that you enter with a mental health professional in which you feel safe, comfortable, and you feel like you have the ability to be vulnerable with them. Something that people don't think about oftentimes when they do start therapy is that the therapeutic relationship that you build with a mental health professional is extremely important to ensure that you have a good fit so that you can come into this space being able to share your story and to receive guidance from a mental health professional. How can therapy help me? Therapy can help you because it's a space where you can come into and just share anything about your life. Whether you have a significant issue that has arisen in your personal life, or you want to dive a little bit deeper into your family history, your own personal history, your childhood, or you want to talk about other issues that are occurring in the world, therapy is a space where you can bring anything, and your therapist with their training can help you feel safe, feel seen, heard, and also provide you with specific guidance. What are all of the letters behind a therapist's name? So all the letters behind a therapist's name can get very confusing at times because there's a lot of them, but generally in California specifically, you'll see, I'll talk about the most common ones. You'll see LPCC, which is Licensed Professional Clinical Counselor. You'll see LMFT, which is Licensed Marriage and Family Therapist. And you'll see LCSW, Licensed Clinical Social Worker. And you can also see all of those, but replace the A with an L to indicate associate. So for example, Associate Marriage and Family Therapist. And the associate part will indicate that someone has completed their education at the master's level, but they are still working under the supervision of a licensed mental health professional until they complete their hours and sit for their licensing exam to then receive the L before their name. What are the different types of therapy? So therapy, typically when you think of it, is an individual session between you and a mental health professional, but there are other different types of therapy that you can engage in. You can engage in couples therapy, you can engage in family therapy, you can also engage in group therapy. Usually group therapy looks a lot different than the others because you'll have many different people in a room talking about a specific topic. So for example, it could be a grief support group therapy. And same thing with family and couples therapy. It'll just be more than one person. It'll be more than just you and the therapist. It'll be other people in the room who are considered the clients. And something else to keep in mind too in terms of different types of therapy is that different therapists can also have certifications in specific evidence-based training or specific modalities that they practice through the lens of. For example, a huge one is CBT, which is cognitive behavioral therapy. A lot of therapists will use that, and you'll typically see the therapist listed in their profiles or their websites. And if you have any questions about their modalities, you can always feel free to ask them. How long is therapy? Therapy is typically around like 45 to 60 minutes, depending on your mental health professional. They may cut it at 50, they may cut it at 60, it really depends, but sometimes group therapy can last for more than an hour as well. It can last for 2 hours. So the real answer is that it really depends, but typically in the individual setting, you'll be there for around 50 to 60 minutes. So what is the difference between a therapist, a psychologist, and a psychiatrist? So the difference between seeing a therapist, a psychologist, and a psychiatrist is the level of education that they have and also the training that they have. In general, when you hear the word therapist, you'll think of someone who gives talk therapy to you, which is usually at the master's level, so your LMFTs, LPCCs, and your LCSWs. And oftentimes psychologists can also give talk therapy, so you'll often see them also be referred to as therapists. But a psychologist who is a therapist has a doctoral level degree, and the difference between these two types of therapists is that a psychologist can actually perform psychological testing, but both therapists and psychologists can assess, diagnose, and treat mental health disorders and other mental health struggles. And a psychiatrist is a little bit different because they studied medicine and they are able to provide medications to help manage any mental health symptoms that you have. What does the first session with a therapist look like? So typically in the first session with a therapist, you'll come into the office or you'll see them virtually, wherever you are. In this first session, you'll go through a lot of introductory processes. So I'm not gonna lie, it is the most boring, probably the most long session that you'll go through, because sometimes this session will last a little bit more than an hour. But essentially you will be going over an intake with the therapist where they'll ask you questions about why you're coming into therapy at this time in your life, any history related to that, such as your family history, your childhood, previous experiences that have led you to this moment in time. And other things that will be talked about during that session is a therapist's like supervision status, if they are currently being supervised, or their licensure status. They'll talk about any like risks that come with therapy, go over consent forms with you, and then the most important thing that they'll also review with you is confidentiality. How do therapists collaborate with other professionals? So typically therapists will collaborate with other professionals in a lot of different ways. For example, a therapist who works with children will collaborate with people such as school teachers, primary care physicians. They'll of course collaborate with parents or caregivers, and anyone else who is involved in that child's life. And what's important to note in collaborations like these is that there are proper protocols to follow in order to ensure that the client's confidentiality is held and that their information is secure and private. So what that means is that we'll typically sign what we call releases of information that indicate that a client is giving consent to the therapist to collaborate with these mental health professionals. And in these collaborations, they really just are for the benefit of the client. So we'll be sharing information in terms of like how we can help the client further in different aspects of their life. How do I find a therapist? Typically, when you start looking out for a therapist, it is very overwhelming. There are a lot of avenues through which you can find a therapist. There are directories like ours at CT Stream, where we have our own directory of therapists. We have all of their information about the way that they practice and their style, and we can help match you with the therapist that fits your needs. But if you're not looking at a directory like CT Streams, you can look at other resources on the internet, such as Psychology Today, that may list a therapist's profile, their style, the way that they practice, etc. And you can use those to then contact a therapist and see if you can schedule an initial consultation call with them, just so that you can have an actual conversation and see if you feel like it's a good fit. The reason I love Changing Tides is our initiative and focus on starting the conversations around mental health, especially with our CT Stream stipend program, which provides 10 free therapy sessions to individuals aged 16 to 35. And it's very important because we are focused on lowering the barriers to accessing mental health services. So if you are interested in getting started with therapy, please feel free to check out our website to learn more information about our CT Stream program. Thank you for learning about therapy with me today.